First of all, good morning, and thank you all for coming and joining us by social media. I'm DeKalb County Sheriff Melody Maddox, and I'm here to give you all an update on how the DeKalb County Sheriff's Office, and specifically the DeKalb County Jail, is managing the ongoing COVID-19 pandemic. Although those of you have loved ones and friends in custody here are still able to communicate with them by mail and by phone, we believe that the larger community should also be kept informed, which is the citizens of DeKalb County as a whole. We want to make sure that you all understand that we are trying to flatten the curve here at the DeKalb County Sheriff. And understand this pandemic knows no boundaries, and we are all in this together, and together we will get through it. My remarks will be in two parts, and then I will entertain questions, and I will be able to defer some of the questions to those experts that stand here before me. And you can submit your questions by clicking on the email link on the home page of our Facebook page, or you can call in to 404-298-8282. Again, that's to go to the email site or go to the Facebook page, send your questions in, or call 404-298-8282. And before I begin, let me acknowledge my colleagues who have joined me today to address any details related to our emergency plan of action that is now in full force throughout the agency. I have Chief Deputy Lorandy Akes here, Jail Commander Pamela Miller, our WellPath Health Services team, Dr. Jacobs, and our Health Services Administrator, Ms. Terry Van Dorm, as well as our Mental Health Services Director, Dr. Brickhouse. We also have with us our valued Public Health Agency partner, District Director for the DeKalb County Board of Health, Dr. Elizabeth Ford. First, I remind you that we are very transparent in our handling of this public health emergency. And to that end, I must report that as of today, we have 10 confirmed cases of COVID-19 among our agency staff members. This represents only 2% of our total employee population. These employees, some who are civilians, some sworn officers, remain away from the office, on quarantine, or in treatment. We are in touch with them, and they tell us that they are doing well. We've had 13 confirmed cases of COVID-19 among our inmates in the jail. While this 13 confirmed cases only represent 1% of the total jail population, which is 1,200 men, 101 women, and those 13 cases that were positive were all male. Those who are in custody are still in isolation if they have been tested positive and are receiving medical treatment. Since the onset of this public health emergency, we have worked to achieve two main goals, and that is to prevent, if possible, the exposure of our inmate population to COVID-19 and to contain the spread of the virus from any inmate or employee who become infected. Like other large institutions, we have been challenged to understand how the virus spread, so we rely on the guidance of experts in the public health field. I would like to thank the DeKalb Board of Health, DeKalb Emergency Management Agency, the CDC, and our other public health partners for their support and their involvement in these matters. Here's an overview of additional initiatives that we are taking, what we have accomplished in our journey so far. First, we have greatly limited access to the facilities. All persons entering the facility, including staff members, vendors, continue to be screened for high temperatures as a condition for access. Officers conducting the temperatures are wearing safety masks. New inmates are being screened for COVID-19 symptoms prior to entering the jail, at which time they are given a surgical mask upon entry. New inmates are immediately quarantined for 21 days before being housed in the general population. The on-site video visitation center at the jail remains closed, but we are still offering limited free use of the remote video visitation services. All special jail programs continue to be suspended, although inmates can still receive emergency information and faith-based counsel remotely. We are complying with judicial orders to legally reduce our jail population. With that being said, in the past 120 days, we have reduced the jail population by 24%. By applying the judicial order by Judge Purdom, we have been able to release 110 inmates on signature bonds. We have implemented extraordinary measures to sanitize the facility. This process is critical in helping lessen the threat of the spread of the virus inside the facility. A weekly schedule of professional cleaning and disinfecting began 2 weeks ago, and we will continue for another 3 weeks. All occupied areas of the jail and administrative offices are being cleaned and disinfected through the second week in May. Inmates have been provided approved cleaning products for their use inside cells and housing units. We are all following health experts' advice to use protective equipment aggressively. All our employees have been issued masks and gloves. Complete personal protective equipment, also known as PPE, outfits including surgical masks and N95 masks, gloves, facial shields, and surgical gowns are available for employees who have direct contact with inmates. Last, we received an additional shipment of 1,000 surgical masks, 500 facial shields, 1,000 N95 masks from the DeKalb Emergency Management, and we want to make sure that we say thank you for them for their response. Regular meals continue 3 times daily. We are now serving almost 4,000 meals per day, with some 12 special diets being prepared for inmates, with medical faith-based food requirements, not to mention that Ramadan starts on this Thursday. All inmates' meals meet the caloric requirements of the American Correctional Association, of one of our accrediting organizations. To further limit exposure, inmate meals are being served in disposable styrofoam containers. Finally, our employees are practicing social distancing as well. We've asked that no more than 10 staff members congregate in any one place inside the facility, including in our staff dining room. Our COVID-19 task force meets twice weekly, sometimes more often, to learn as much as we can from health experts about the effectiveness of the actions we are taking. Our plan of action is constantly changing to include the newest approaches to containing this pandemic at our facility. And we try to keep you up to date and to know that we are truly doing all that we can to get through this. For additional information in regards to anything at the DeKalb County Sheriff Office, please visit our website at DeKalbSheriff.org. I want you all to know that you have my personal commitment and the commitment of our staff that we will not lose sight of our mission. And our mission is to always demonstrate excellence, accountability, and respect in our professional and personal lives. We are part of the community and value their expectations. We will always respect and honor the rights and dignity of those we serve. At this point, I will take any questions.
Sheriff, about a month and a half ago, maybe we were here for inside for a press conference and talking about the initial steps we're all taking. Since then to now, how do you feel your department and the jail has done with the response?
I think this agency has done exceedingly well. I'm very proud of the administration, the staff, and all the employees of the DeKalb County Sheriff Office. We've gone above and beyond what is needed for this agency, including listening to and making sure that we take heed to our professional experts that stand here with me. So we're still following the CDC guidelines in reference to this pandemic, and we know every day this is something that's changing and it's fluid, so we're going to keep going. Questions?
Is Yes, ma'am. You have an email question. It's from Valencia Jones with CW69.
Yes.
Her question is, how do you plan to enforce the restrictions for those businesses that will be allowed to reopen on April 24th and April 27th in accordance with Governor Kemp's announcement yesterday?
Well, first of all, we rely on the business to use some sort of discretion as they open their business and to still follow the CDC guidelines. We will actually have, if we have manpower available, to go out to assist. We don't want to arrest anybody, but we just want people to use common sense and some sort of discretion in reference to opening these businesses up. That's it. No other questions came in. Well, again, thank you so much. I appreciate it. No questions from my partners. I guess, Dr. Ford, that's pretty good for you, huh? But I thank you all so much. But I do want the citizens to know that we are here to continue to serve them and serve them proudly. And that, I thank the DeKalb County Sheriff Office, all the employees that you see here. Dr. Ford, thank you so much. To my WellPath team, thank you all so much for their guidance, for their insight in this, as well as Dr. Brickhouse for my mental health. We thank you so much. The Chief Deputy here, Jail Commander, have all been working day in and day night, and I couldn't ask for a better team and better leadership here at the DeKalb County Sheriff Office, and I look forward to continuing to work here at the agency. Thank you so much.